In the corners of microbiology, the rubella virus is a potent threat that sneaks through a rash and captivates others coming in contact with it. The ordinary-looking red spots wreak chaos on the delicate body of humans. Rubella is so merciless that it does not even spare babies who are still in their mother's womb. But where there is hope, there is a way. Because of scientific advancements and the tireless efforts of medical warriors, there are vaccines available that make humanity stand tall against this deadly pathogen. Let's move on to unravel the mysteries of the rubella virus and how it targets adults and children. What is rubella? Rubella is an acute viral infection characterized by a red rash starting from the face and spreading all over the body. Rubella rash is almost similar to measles, but the causative agent of rubella is a different virus than measles. Therefore, it is often known as German measles or three-day measles. Rubella is a contagious illness, but it is mostly mild. Rubella can affect both children and adults. However, there is a special syndrome called congenital rubella syndrome, CRS, that affects unborn babies very severely. Rubella was completely wiped off by the US in 2004. However, it is common in some parts of the world, particularly Asia, Africa, and the Middle East. Approximately 26,000 cases of rubella are reported each year globally. What is congenital rubella syndrome? CRS is the most severe complication of rubella during pregnancy that affects unborn and newborn babies. If a pregnant mother contracts rubella, then this virus will be passed down to the fetus. The baby that will be born has no proper organ development and suffers from many defects, including cardiac, cerebral, ophthalmic, and auditory faults. CRS is also responsible for premature birth, low birth weight, thrombocytopenia, anemia, and hepatitis. However, the majority of mothers get infected with rubella during the first trimester, which consequently leads to miscarriage or even stillbirth, as the first trimester is the period where organogenesis occurs and different organs of the baby develop. Therefore, rubella infection is very threatening during the first trimester. About 100,000 cases of CRS are reported each year. What causes rubella? It is caused by a virus known as rubella virus, often abbreviated as RUBV. Scientifically, the rubella virus is called Rubivirus rubellae. It belongs to the genus Rubivirus and the family Metanovirridae. It has single-stranded RNA as its genome. Rubella virus follows the respiratory route and grows inside the nasopharynx and lymph nodes. The incubation period is usually about 5 to 7 days. The genus Rubivirus has two groups. One group consists of the rubella virus RUBV that infects humans and uses them as their reservoirs. The second group consists of those rubiviruses that infect other animals as their reservoirs. Guangdong Chinese water snake rubivirus, which infects snakes; Fadala virus, which infects fish; Ruhugu virus, infecting bats; and Rustrela virus, which uses mice as their reservoirs, are some of the examples of non-human rubiviruses. Presently, 4 genotypes of rubella virus are responsible for causing infections in various regions of the world. Those 4 genotypes are 1EU, 1JU, 1J, and 2B. How does the transmission of rubella occur? Rubella virus is only known to infect humans, thus making humans their only reservoir. Rubella is a highly contagious disease that spreads through direct contact among humans. Being airborne virus, it also spreads through respiratory droplets. When a person infected with rubella coughs or sneezes, the little virus-containing droplets land on the surfaces or are suspended in the air. Individuals are highly infectious and are capable of spreading this virus for 5 to 7 days after catching this infection. The infected individuals are also potent carriers, even when the rash becomes apparent, and continue to carry and transmit the virus 7 days after the appearance of the rash. Apart from that, this virus can pass through the placenta. Therefore, infected pregnant women have a high chance of having their babies die during pregnancy, or have congenital rubella syndrome. The rubella virus plays with organogenesis during pregnancy, thus leading to improper organ development in the fetus. What are the signs and symptoms of rubella virus infection? Rubella virus infects both adults and children of any age. Approximately 50% of the cases are asymptomatic or have milder symptoms. Symptoms are usually similar to flu, but the appearance of a distinct reddish-pink rash differentiates this from measles and flu. However, the main feature of rubella virus infection is exanthem. Exanthems are itchy rashes that are spread all over the body and associated with fever and malaise. Viremia occurs and includes other symptoms such as swollen lymph nodes, fever of 100 degrees Fahrenheit, joint pain, headache, cough, sore throat, runny nose, and conjunctivitis. The rash usually goes away within 3 to 4 days. Therefore, it is termed as 3-day measles. Almost 20% of the cases display Forchheimer spots. Forchheimer spots are red, with small papules on the soft palate. Sometimes, coryza or cold-like symptoms are also additional features in older children and adults. If left untreated, coryza can turn into viral or bacterial pneumonia and bronchitis. Apart from that, encephalitis, ear infection, and low platelet count are also severe complications of the rubella virus. Symptoms of congenital rubella syndrome: cataracts, glaucoma, hearing loss, heart and brain defects, microcephaly, hemolytic anemia, thyroid disease, hepatosplenomegaly, and type 1 diabetes are the symptoms and complications of congenital rubella syndrome. Diagnosis of rubella virus infection. Rash resulting from the rubella virus is often indistinguishable from rashes of measles, parvovirus 19, human herpes, virus 6, Coxsackie virus, adenovirus, Ajanus and Dengendate. Therefore, laboratory diagnosis is crucial to identify the rubella virus. Blood tests, urine tests, and throat or nasal swabs are the common samples taken to diagnose rubella virus infection. The presence of antibodies against the rubella virus in the blood shows a positive test. How is rubella treated? There is no specific medication for rubella, and it goes away on its own. The use of over-the-counter medicines is usually enough to treat the general symptoms of rubella. How can rubella be prevented? There are 2 vaccines available for rubella, named as MMR and MMRV vaccine. MMR vaccine is given to 12 months or older children, while the MMRV vaccine is administered to children between 12 months to 12 years of age. Women make sure to vaccinate themselves against rubella before getting pregnant or during the first few weeks of pregnancy. Avoid sharing personal items with other individuals. Mouth and nose should be covered before coughing and sneezing. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.